We have the pleasure of having Dr. Chris Harner with us. Dr. Harner is the Blue Cross of Western Pennsylvania Professor of Orthopedic Surgery at the University of Pittsburgh School of Medicine, and he's the incoming president of the American Orthopedic Society of Sports Medicine. Dr. Harner is regarded internationally and nationally as an expert in sports medicine and specifically knee surgery. He's been consistently named among the best doctors in America Northeast region and is one of Pittsburgh's top doctors by Pittsburgh Magazine. He serves as a team physician for many local Pittsburgh high school sports teams, and he's extremely passionate about trying to prevent sports injuries in our youth. Thanks very much, Dr. Harner, for joining us tonight.
Good evening, everyone. I'm going to be presenting on knee overuse, prevention, and treatment. First, I would like to say kids are not little adults. Pediatric athletes are unique. Their skeleton is immature. Their growth plates or epiphysis are open. Shown here on the slide with the blue arrows are the growth plates about the knee. These are weak links and make injuries more likely. Growth spurts in children decrease flexibility and agility, and muscle imbalance and stiffness across joints predisposes to injury. Growth spurts in children do play a role in injuries, and boys are different than girls. Boys reach puberty later, they grow taller and heavier at a later age, and they reach adult height at about age 18, whereas girls are age 16. Why do knee injuries occur? Overuse injuries are twice as common as acute or traumatic injuries to the knee. Usually this is because the kids do too much too fast. Injuries rarely occur in free play activity, but many studies have shown that injuries are much more common in organized sports. What are the symptoms of a knee injury? This is very important. Tenderness to the touch, stiff and limited bending due to pain, swelling, lumps and bumps about the knee, feeling like the knee is catching or locking, and the two most important symptoms are pain and trouble walking or running. These are red flags that must be looked at by a specialist. What are the common knee overuse injuries? There are many, but I'm going to put two up here that are two most common in the knee. Something called Osgood-Schlatters disease. This is injury to the attachment of the patellar tendon. As you see on the slide where the red area is, that's where Osgood-Schlatters occurs. It looks like a bump on the knee, and it is the most common overuse injury to the knee. Patellar tendonitis, or jumper's knee, is associated with repetitive jumping. This occurs during a period of rapid growth. Patellar tendonitis is located at the patellar tendon insertion onto the kneecap, and it usually occurs in slightly older children. What are the common causes of traumatic knee injuries? Growth plate injuries, bone fractures, kneecap instability, meniscal tears, and ligament tears. The most common ligament injury that we see in children, this has come out over the years with many studies now, is a tear to the anterior cruciate ligament, or the ACL. Here are some facts about pediatric anterior cruciate ligament injuries. Tears to this ligament occur because the ligament is overstretched. Injury usually occurs while an athlete is playing sports that involve cutting and pivoting, like soccer, skiing, basketball, gymnastics, volleyball, and football, but in reality, it can happen with any sport. 10 to 15% of teenagers who've torn an ACL will tear their ACL again. And girls are 2 to 8 times more likely to tear their ACL than boys. So there is a difference between boys and girls. Some further facts. Unfortunately, the ACL does not heal. Once it's torn, it's torn. Often what's required is surgical treatment to replace the torn ACL. With appropriate treatment and rehabilitation, most children who undergo ACL reconstruction can return to full sports participation in 6 to 12 months. How can knee injuries be prevented? There have been many studies that have looked at this. They can participate in age-appropriate training routines. They can wear properly fitting equipment, including shoes and knee pads, and limit repetitive jumping and activity for long durations. How are knee injuries treated? Especially for overuse injuries, rest and activity modification often are very successful in treating these injuries. Short-term anti-inflammatory medications, ice, stretch and strengthening programs, and appointment with healthcare providers. Athletic trainers and physical therapists are very good at this initial management and diagnosis and management, but a sports medicine physician, someone who specializes in sports medicine, who's a physician, is often needed to be involved. Bracing, physical therapy, and sometimes surgery is necessary to treat these injuries. In summary, overuse injuries occur because of repetitive stress. Kids are uniquely predisposed to overuse knee injuries. The knee is the most commonly affected joint for overuse injuries in the body in a child. You should definitely speak with a physician or healthcare provider because early treatment can shorten recovery time. Thank you very much.